It is a great pleasure to present the main findings of this study entitled Incidence and Risk Factors for Patellofemoral Dislocation in Adults with Charcot Marie Tooth disease, also known as CMT. This talk will give you a better understanding of the extent of this phenomenon and knowledge of the risk factors of patellofemoral dislocation in people with CMT that can be addressed by clinicians through preventive and supportive measures in order to improve the clinical management of this condition. Patellofemoral dislocation has been defined as a clinical entity that usually causes a traumatic disruption of the peripatellar structures. Clinicians notice that there appears to be a high frequency of patellofemoral dislocation in routine clinical practice. To date, however, only one study involving 50 children with CMT1A has investigated the incidence of patellofemoral dislocation in the CMT population. Previous studies conducted in non-CMT population have explored the risk factors associated with patella dislocation, such as patella alta, trochlear dysplasia, excessive tibial tuberosity, trochlear growth, and generalized hyperlaxicity. However, the risk factors for patellofemoral dislocation in CMT are currently unknown. Therefore, the study aimed to fill the existing gap in literature by understanding the incidence and risk factors for patellofemoral dislocation in adults with Charcot-Marie Tooth disease. The main objective of this study was to establish the incidence of patellofemoral dislocation in adults with CMT. The secondary aim was to explore the potential risk factors that predispose adults with CMT to experience patellofemoral dislocation. This was a cross-sectional observational study that took place at the MRC Centre for Neuromuscular Diseases in London. English-speaking adults with a genetically and/or clinically confirmed diagnosis of CMT who attended day outpatient clinics at the MRC Centre between May and December 2019 were invited to participate in the study. Those presenting with other significant neurological and musculoskeletal conditions, such as previous history of knee replacement, osteoarthritis, and movement disorders, were excluded from the study. Study participants were interviewed with the aim of collecting subjective history of previous patellofemoral dislocation. Participants also underwent a patellofemoral assessment, including an evaluation of the possible presence of patella alta, lateralized tibial tuberosity, lateral patella gland, and J sign. They also underwent a comprehensive lower limb assessment, including an evaluation of muscle strength, sensation, generalized joint hypermobility, and foot posture. They were also screened for the possible presence of Ehlers-Danlos syndrome. For the purpose of this talk, I'm going to present only the main results of this study. 81 people and 161 knees were screened for patellofemoral instability, and as 18 out of 81 people had a positive history of dislocation, the incidence was estimated at 22.2% in this cohort of people with CMT. With regard to the risk factors, so we found that within the dislocation group, there was a significantly higher proportion of knees presenting with patella alta, lateral patella gland, J sign, generalized joint hypermobility, and Ehlers-Danlos syndrome. Only patella alta and lateral patella gland resulted to be independent predictors of patellofemoral dislocation. And knee flexors ipsilateral to dislocating knees resulted to be weaker than those ipsilateral to non-dislocating knees. Patellofemoral dislocation incidence was higher in adults compared to children with CMT. This seems to suggest that people with CMT carry on dislocating during adulthood. The incidence of patellofemoral dislocation in adults with CMT was not directly comparable with that reported in the general population, as different methods to establish the incidence rates were used. In agreement with previous studies, patella alta, trochlear gland, and J sign were significantly associated with patellar dislocation, but only patella alta and trochlear gland had an independent role in determining the occurrence of patellar dislocation in people with CMT. Clinicians could offer to these people presenting with these risk factors patellar stabilizing braces in order to prevent patellofemoral dislocation. In agreement with the available literature, generalized joint hypermobility and Ehlers-Danlos syndrome were significantly associated with the risk of patellar dislocation. And as knee flexors ipsilateral to the dislocating knees resulted to be weaker than those ipsilateral to non-dislocating knees, clinicians could offer to those people presenting with weak knee flexors strengthening exercises in order to prevent patellofemoral dislocation. With regards to the implications of this study, we suggest that colleagues include consideration of patellar dislocation in their assessment of people with CMT, as there are a number of rehabilitation options available to manage patellofemoral instability. With regards to the future research, we think that future studies with larger sample sizes are needed to confirm the findings of our study, and future longitudinal studies are needed to establish the causal relationship between patellofemoral dislocation and the identified risk factors. If you do have any questions or you want to find out more about our study, please feel free to contact me. Thank you for your attention.